Thank you everyone for joining us today for part of our lifestyle medicine webinar series. Today we'll be talking about movement, physical activity, and hopefully by the end of this webinar, we'll be able to determine, is movement medicine? I'm so pleased to have join us today two fantastic presenters. We have Dr. Elizabeth Nguyen, who is a certified physiatrist in physical medicine and rehabilitation. She is fellowship trained in interventional spine and sports medicine and specializes in the non-operative care of spine conditions, sports injuries, and general musculoskeletal disorders. Dr. Nguyen grew up in Houston, Texas, and received her Bachelor of Science from MIT. After obtaining her medical degree from Columbia University, she completed her residency training in physical medicine and rehab at New York Presbyterian Hospital. While in her residency, she served as chief resident and was awarded several honors for excellence in patient care. She subsequently pursued a fellowship in interventional spine and sports medicine at HSS. And after several years in private practice, she returns to HSS Department of Physiatry. After our presentation with Dr. Nguyen today, we'll also have Kelyssa Hall, who is an exercise physiologist in sports rehabilitation and the performance team at HSS. She graduated from the University of Illinois at Urbana-Champaign with a bachelor's degree in kinesiology. Kelyssa is a certified strength and conditioning specialist with the National Strength and Conditioning Association and a certified ergonomic assessment specialist through the BAC School. Kelyssa has been in fitness and rehabilitation for over 28 years. And she has extensive background working with the older population and people with complex health issues, and a passion and drive for helping people get back to what they need and love to do. She strives to empower people to live their best life by working with them to integrate physical activity and healthy habits into their daily routines while focusing on functional movement, balance, strength, and endurance. I really couldn't think of two better presenters today to join us.
So my name is Elizabeth Nguyen. I'm a physiatrist here at the Hospital for Special Surgery. And today I'll discuss the benefits of exercise with a special focus on common orthopedic conditions. We'll review the physical changes to our musculoskeletal system that are affected by age and conclude with a brief discussion on the common barriers to exercise. I'd like to open with a quote from Hippocrates, a renowned ancient Greek physician, referred by many as the father of medicine. All parts of the body, if used in moderation and exercised in labors to which each is accustomed, become thereby healthy and well-developed and age slowly. But if they are unused and left idle, they become liable to disease, defective in growth, and age quickly. There's strong evidence in our research literature that supports the positive association between exercise and improved health. Everyone benefits from exercise, whether they are young or older, or whether they are healthy or have chronic medical conditions. Both cardiovascular and resistance exercises are key factors in improving health and quality of life. Physical inactivity is an underappreciated but modifiable risk factor for many chronic health conditions. Exercise can be effective in the primary prevention of at least 35 chronic diseases. And a dose-dependent relationship between exercise exists with certain diseases. So the more we exercise, the lower the risk of these health conditions. Exercise can also reduce the risk of disability by up to 50%. Unfortunately, few adults reach the level of physical activity that can improve health. The benefits of exercise are vast and positively impact a very wide range of body systems and domains of life. Exercise reduces the risk of many health conditions, most notably cardiovascular disease, metabolic disorders such as diabetes, and certain types of cancers. It can also improve mood disorders and improve brain or cognitive function. Exercise has been shown to be protective for individuals with mild cases of dementia and Alzheimer's disease. It can also improve the chances of longevity by reducing the risk of premature death by up to 50%. Exercise strengthens bones, joints, and muscles. which can all mitigate the risk of falls and improve an individual's ability to perform daily activities independently. It can also help optimize weight and reduce inflammation, both of which are linked to many health conditions, including arthritis. Exercise can improve stress and elevate your mood and energy, as well as promote better sleep. And importantly, it can reduce pain. All of these individual benefits can synergistically work together to reduce pain. Let's take a closer look at each of these benefits, starting with the musculoskeletal system. Exercise can strengthen bones, it can stimulate hormones that boost muscle growth, and the soft tissues that move and stabilize the joints, as well as the spine, benefit from improved flexibility and increased blood flow. According to the World Health Organization and CDC, obesity is defined as abnormal or excessive fat accumulation. A body mass index, or BMI, of over 30 is considered obese, and it can contribute to low-grade levels of whole body inflammation that can affect multiple joints. For these individuals, losing at least 10% of current body weight can lead to significantly improved pain and quality of life. From a joint health standpoint, optimal weight can minimize joint stress as well as joint pain, and many studies demonstrate an inverse relationship between physical activity and weight gain, meaning greater physical activity can result in greater weight loss. Chronic pain conditions may be associated with systemic or whole body inflammation, and physical activity has been shown to reduce this. 2 studies illustrated here demonstrate that exercise can reduce inflammation, one that involves aquatic exercise over 8 months, and another that involves aerobic exercise, as well as low-impact movement therapies, such as Tai Chi. Exercise releases endorphins, which elevate mood and also reduce stress hormones, such as cortisol and adrenaline, over time, and this can lead to better sleep. And better sleep leads to a positive feedback loop, where individuals have better mood, more energy, less stress, and a greater desire to naturally increase their physical activity. A study involving the practice of Tai Chi over a period of 3 months improved sleep in patients with fibromyalgia. Chronic pain rates are increased in the elderly and inactive population. Exercise may have a protective effect on preventing the development of chronic pain. A few studies demonstrated that exercise may be just as effective as NSAIDs, such as ibuprofen and naproxen, without the potential side effects of these medications. Endorphins are also a natural pain reliever, which can potentially reduce the reliance on pain medications. Exercise can lead to physiologic changes in the brain to mitigate pain. Opioid and serotonin levels, which are chemical neurotransmitters in the central nervous system, are involved in pain reduction and have been shown to increase with exercise. And repeat exercise has been shown to lead to more prolonged pain relief. Large-scale human and animal studies show that individuals who are more physically active have a lower risk of developing chronic pain. Studies combining aerobic exercise, resistance training, and flexibility exercises have shown to improve chronic pain. In this Norwegian study, the incidence of chronic musculoskeletal pain was up to 38% lower in those who participated in moderate degrees of activity versus those who did not exercise. When encouraging individuals to be more active, I wanted to highlight that exercise can sometimes increase pain in those with chronic pain conditions. This can be explained by central nervous system changes that lower our pain thresholds. This is a process called central sensitization, and it's been documented in individuals with knee, hip, and low back pain. Studies have shown that this increased sensitivity can potentially be improved and reversed with consistent exercise. And there are a number of strategies that we can use to promote pain-free exercise, introducing low-impact movement therapies such as yoga, tai chi, and qigong, can be safe. Starting low and going slow can reduce pain flare-ups, and combining therapies with other treatments, including a biopsychosocial model, can improve outcomes by addressing not only the biology of the condition, but also the psychological and social contributors to it. This can include mental and emotional health, as well as external stressors such as family and work. We can better empower individuals with positive coping strategies, healthy lifestyle choices, and long-term exercise adherence. Now let's review a few common musculoskeletal conditions and how exercise can benefit them. These are a few conditions that we see and treat here. And we'll start with hip and knee osteoarthritis. Osteoarthritis is different from normal aging of the joint where the cartilage is still relatively healthy. This affects cartilage, bones, and tissues that line the joint. And part of the disease process involves an increase in the enzymes that degrade cartilage. This leads to cartilage loss, inflammation, pain, and ultimately loss of mobility. Certain risk factors, such as obesity and deconditioned muscles, can be modified to prevent the onset and progression of arthritis. Exercise therapy is considered a core treatment for osteoarthritis and is generally not associated with risk of serious harm. The benefits of exercise are summarized here. In those with hip and knee arthritis, these benefits are significant and supported by high-quality evidence. We can see trends that multiple forms of exercise, including strengthening, flexibility, and aerobic exercise, are beneficial, more so than general activity. And these benefits can be sustained for many months, even if exercise interventions conclude. As mentioned previously, obesity can contribute to low-grade levels of systemic inflammation, and this can affect multiple joints. Using exercise as a tool to manage weight can help reduce joint pain, and losing 1 pound of body weight can reduce stress across the knee joint by 4-fold, or 4 pounds. There are a few studies showing that exercise was more effective than usual activity and equally effective as medications such as acetaminophen and NSAIDs. Exercise has advantages over medications in that it can be practiced over long term without the same potential side effects. And this has yielded similar or greater improvements when compared to conventional injection-based treatments, including hyaluronic acid, which is a gel or lubricant, as well as steroid injections, which are a powerful anti-inflammatory. With regards to low back pain, 60 to 80% of patients will experience back pain at some point in their lives. Many cases of back pain are related to a reduction in core and back strength. Moderate exercise can lower the prevalence as well as the risk of low back pain by up to 23%, and a range of exercises have been shown to be beneficial. But similarly for pain as well as for OA, they should ideally incorporate a combination approach involving strengthening, flexibility, and aerobic conditioning. Studies have shown that exercise is more likely effective than education alone, and studies similar to those for knee and hip OA, exercise is likely to be more effective than no treatment, usual care, which means usual activity, or placebo. A few studies compared exercise and medications, including NSAIDs and duloxetine, which is an antidepressant that we often use to treat pain. And exercise has shown better outcomes for low back pain, which again can be implemented longer term without the potential for side effects. Those patients who tried opioids or duloxetine were more likely to discontinue treatments due to adverse side effects. The last condition that I'll cover relates to osteoporosis. This is characterized by deterioration of bone tissue, low bone density, and reduced bone strength. This can predispose us to developing bone fractures. There is convincing evidence that exercise can both prevent as well as slow the rate of bone density loss, with greater effects seen on the lumbar spine versus the hip. Exercising when we are younger can help prevent osteoporosis as we age. And when we're older, can also potentially reverse bone loss by 1% per year. Bone changes in response to the forces placed upon it. So when you participate in weight-bearing exercises or strength training, your bones respond by building more bone, and this can increase bone density. Weight-bearing exercises are anti-gravity loading exercises created by your own body weight, and the examples of those are listed here. And examples for resistance exercises are listed here. Those that engage in high-impact exercise, such as jumping, might have a better chance of increasing bone density. Although in older patients and individuals, this may not be ideal due to balance or mobility concerns. Exercise programs that yielded significant impact involved an hour or more of exercise 2 to 3 times a week over a course of 7 or more months. And exercises for bones are notably site-specific, meaning exercises such as weight-bearing and lower body exercises tend to improve hip and spine bone density more so than wrist bone density. Older adults are at risk of fractures primarily along the wrist, hip, and lumbar spine. And there's moderate quality evidence from systematic review articles showing that exercise can reduce the risk as well as incidence of fractures among active individuals. Now we'll review the changes that our musculoskeletal system undergoes with age and how exercise can address these changes. After the age of 30, we start to lose bone density as well as muscle mass. By age 50, our joints and spine also begin to age. In addition, coordination and balance impairments may develop, as well as reduced endurance and cognitive decline. All of these changes can impact functional independence, and exercise can improve as well as slow the progression of many of these changes. We begin to lose muscle mass as early as age 30. In our 50s and beyond, we start to lose about 10% per decade. This leads to reduced strength and protection across joints, as well as the spine. You may have heard of the term sarcopenia. This refers to the progressive loss of muscle mass and strength resulting in disability and poor quality of life. Here's a brief summary of the causes of muscle mass loss, and the highlighted ones are those factors that we can change. Bone density begins to decline at the age of 30. This accelerates in women after menopause, and typically it's a painless process, but as mentioned previously, this can increase an individual's susceptibility to fractures. And again, physical inactivity has been shown to be a contributor to bone loss, which is modifiable. There are various age-related changes that affect joints and the spine, some of which can be slowed with exercise, as shown in previous studies. Our coordination also declines with age, which can affect both fine and gross motor movements. And again, among some of the causes, a decline in physical activity is a modifiable factor. Our last topic of discussion is a brief summary of the various barriers to initiating or maintaining exercise. The most common reasons for not engaging in exercise among older adults include pain, injury, and poor health. Fear of increased pain is a significant barrier to exercise, and patients may also be hesitant to exercise due to a lack of clarity regarding their condition. Sometimes limited access to resources present an occasional barrier, though many exercise programs these days can be performed at home and with minimal equipment. Many of these barriers can be overcome through counseling and optimizing treatment of underlying medical conditions. In summary, exercise has multiple benefits across many domains. It strengthens and slows the effects of aging, and it can also reduce pain and inflammation. Generally, more exercise yields greater benefit for reducing the risk of many health conditions. Engaging in a variety of exercises is more effective than one single type of exercise for chronic pain, arthritis, back pain, as well as osteoporosis. And in a few studies, exercise was comparable to acetaminophen, NSAIDs, as well as injections for osteoarthritis and back pain. Many of the barriers to exercise can be overcome with effective education and management of underlying conditions. Thank you, everyone, for your time and attention. And now I'd like to pass the presentation on to Kelyssa Hall, an expert in her field and a highly regarded colleague. Thanks, Kelyssa.
Thank you, Dr. Nguyen.
Okay, I think section.
There we go. Okay, so now I will share my screen. This. Okay, do we have a thumbs up on the screen?
All good.
Show. Okay, well, thank you for having me. Thank you for joining in, everybody. I'm happy to be here. So movement, that's what we're here to talk about, movement and what we can do to keep moving. Movement is many things. Movement is stretching, biking, swimming, planking. Movement is water aerobics, walking. Movement is yoga. Movement is carrying heavy boxes out of the garage, jumping rope, throwing a grandchild up in the air. Movement is playing golf, playing tennis, running. Movement is everything that we do and using our bodies to do it. So it's a really important topic here that we understand and take and embrace and add into our lives. So what's the difference between exercise and physical activity? As defined by the Institute of Medicine, which is part of the U.S. Department of Health and Human Services, exercise is planned, structured, and repetitive movement to improve or maintain one or more components of physical fitness. Then on the other hand, physical activity is body movement that is produced by the contraction of skeletal muscles. I encourage you to stay physically active throughout your day and to also dedicate time in the day for specific exercises. So walking to the grocery store and taking the stairs instead of the escalator would count as your physical activity. And then doing your home exercises and stretches in the morning, that would count as your dedicated exercise. So there is a difference, and we want to make sure that we get equal amounts of both. Sometimes prioritizing movement and exercise can be challenging, and we all may face those different barriers, as Dr. Nguyen highlighted earlier. These statements are understandable and relatable barriers that really can get in the way of our achieving our goals. So the goal of this lecture is to present ways to eliminate these barriers one by one so that we can strive for success and make movement a priority. One of the most important things to remember from this presentation is to always consult with your doctor when starting a new exercise program. I think that's important to remember. And then let's talk about fall prevention, because we want to make sure that we're safe when we're starting to exercise. Are you a fall risk? If we're going to start a new exercise program, we want to make sure we're able to do it safely. And as Dr. Nguyen highlighted earlier, your muscle mass does degrade with age, which can lead to weakness in the joints, a decrease in functional ability, or the ability to do activities of daily living. Having that decreased muscle mass means decreased strength, which is a risk factor for falling. Limitations in the mobilities of the joint can lead to difficulty with balance. Some medications can cause dizziness or lightheadedness, either with their own or with taken with other medications, causing the potential for losing your balance. Being visually impaired can affect your balance. Visual problems with depth perception can cause balance issues when walking, stepping up onto a curb, or even taking the stairs. Having poor posture can contribute to loss of stability. If your posture is rounded and shifted forward, then this can shift your center of gravity forward, causing more potential to fall in that direction. And then just simply being fearful of falling can be a huge risk. Being afraid of falling can create a tension that sometimes is hard to overcome when faced with a potential fall. So what can we do to prevent falls? Declutter, remove all those obstacles that may be in the way when moving around the house, especially at night, like those rugs that stick up on the corners or pet toys, which is all over in my house. Wear your proper footwear when taking walks and running errands and doing daily tasks. Wear proper eyewear and get those regular eye checkups to make sure your prescription is appropriate, since our vision can deteriorate as we get older. Eat a proper diet full of protein to help maintain that muscle mass. If you are exercising correctly and recovering properly, but you don't provide the right nutrients, the body cannot build muscle. Protein plays a huge role in muscle development and growth. And some good basic sources of protein are your fish, poultry, meat, pork, eggs, milk, protein drinks, cottage cheese, yogurt, nuts, seeds, and even some soy foods. Monitor all your medications with your doctor and their symptoms and be aware of all possible negative interactions. And then last but not least, exercise regularly with goals focusing on strength, balance, posture, mobility, and endurance. So we're going to kind of dive into that exercise topic here. So speaking of goals, the first step of maintaining your fitness is to just set some goals. Setting realistic and attainable short-term and long-term goals can set you up for success. Your goals may include playing a sport again, losing weight, being able to do certain daily activities just that need to get through your day and that have gotten challenging. You may want to prevent injury. You may want to get stronger or more flexible before an upcoming surgery, or you may need to just continue rehab and performance after a surgery. And all of these are very important goals and are catered to your individual needs. Now you're standing at that starting line of a new journey, an exercise journey, and you have to already set your goals. It's important to always start with an assessment from an exercise physiologist or any other fitness professional. You want to have a clear understanding of your current physical ability and function, and that's your point A, your goals and needs, which is point B, and then a plan of how to get from A to B. So for an assessment, you want to take into account your previous medical history, your surgical history, your goals that you've just set for yourself, and your exercise history, such as what has worked in the past, what hasn't worked in the past. Assessing where your body's state of physiological function is at the beginning of a program is important to help steer the direction of what you need to help accomplish those goals. And then further reassessing along the way as you progress through a program and achieve those goals sets you up for making new goals. The performance team here at HSS has created the performance pyramid to provide a lens through which we collect information, interpret it, and then organize in order to build a better, effective exercise program. The key concept to understand here is that movement, functional tasks, and even sport-specific tasks require an underlying foundation of basic human functions, such as posture, mobility, strength, cardiovascular fitness, and then that body composition and lifestyle. If these fundamental aspects of that physiological function are not developed to meet the demands of a sport or activity, chances are high that reduced performance, compensation, or potential injury can occur. The foundations of the pyramid are non-negotiable when trying to develop higher levels of function, since the margin of error for poor movement is small. We don't want to move incorrectly. We want to move properly so that we're building a strong body. Inadequate development of that strong base can lead to that injury and potential impaired performance. And it's also important to mention that your education on the whys is important. If you understand the progression of what you are doing, and then if you understand the whys, you're more likely to adhere to a program, which is what we want. So good posture. It's important to prevent injury and allow the body to function individually. Static posture occurs when you're maintaining one position or alignment of the spine for a prolonged period of time. So that's your standing, you're sitting, you're kneeling. And then your dynamic posture occurs when the body is moving through space and changing position. That's your walking, your running, your jumping, just about anything else. Improving postural awareness and control will ultimately help improve balance, especially if you are a fall risk. Proper postural alignment includes maintaining alignment of the cervical, thoracic, and lumbar spine, maintaining a neutral pelvis, and avoiding awkward postures. And here's a graphic kind of representing some of the different awkward postures that we can see and how it looks to deviate from that good alignment. The middle picture is good with the head in line with the body and all the natural curves protected in the posture. But then you can see in the first picture, the head is forward, the shoulders then round forward, the chest drops, and the knees jut forward, creating imbalances throughout. And in the other picture on the right, again, we have that forward head, rounded shoulders, hips and pelvis jut forward, and again with that rounded upper back. So just some basic postural alignment strategies. You just always want to keep that head in line with the body and don't let that chin jut forward. Opening and lifting the chest will help keep your shoulders from rounding forward. Try not to allow those shoulders to shrug upwards towards your ears. Squeeze the shoulder blades. This will engage the upper back musculature to help support the neck and low back. Engaging the muscles of the trunk and core on all sides of the torso will help support that static and dynamic postures as you move through the day. And then stand with your feet hip width apart, which will allow for a stable base of support through all postures. Flexibility enables mobility of the joints through their full range of motion without excessive strain on the joint or soft tissues, allowing healthy movement patterns to occur without compensation. Mobility, or lack thereof, dictates movement patterns throughout the kinetic chain. When I say kinetic chain, I mean the kinetic chain of muscles from your fingertips to your toes. It's all connected. Restricted movement at one joint can cause compensations to occur elsewhere and may promote those poor movement patterns. Factors affecting the mobility are your genetics, gender, physical activity, age, previous injury, and even body temperature. So what type of program are we talking about when we say mobility and flexibility exercises? We're talking about any physical activity that maintains or increases flexibility using slow movements that terminate in static stretches for each muscle group. So your static stretching is where you hold a position at its end range to feel a stretch in a certain muscle group. Dynamic stretching involves actively moving your muscles and joints with a set motion for like a set of repetitions. These can be like head rolls, walking lunges, leg swings, just anything that with each turn you stretch just a little bit further using fluid movements. Yoga is an excellent activity that promotes improving mobility by incorporating movements that work through a full range of motion and holding positions. Getting a massage is also a good way to promote mobility and flexibility. And then foam rolling is sometimes used to increase mobility using self-myofascial techniques. And there are many different types of self-massage gadgets on the market, which can be helpful, but you want to make sure you're choosing the right thing for you and your body and what feels comfortable. So just some basic flexibility strategies. Decide on the best time of day for you to stretch. Maybe you're a morning person or an evening person. Planning ahead will set you up for success. Incorporate mobility into your exercise. Stretching alone isn't the only way to improve your mobility. Many daily activities can help promote that mobility as well. Be consistent and keep up with your practice and keep stretching every day. Over time, you should feel less stiffness when you wake up. Pay attention to your body's signals to let you know if you're stretching too far. Stretching should apply gentle pressure to your muscles and joints without causing pain. Breathe, don't hold your breath. Take deep breaths, inhale through your nose, and then exhale through your mouth. And that properly supplies oxygen to the muscles for proper function. And then hydrate. Drink plenty of water to ensure proper stretching of the muscles that can cramp up if they do get dehydrated. So moving on to strength, muscular strength and endurance are key components of fitness and may improve athletic performance, decrease your risk of injury, and increase your resting metabolic rate and maintain or increase bone mass. Strength training programs include progressive weight training or weight-bearing exercises and other strengthening exercises that use major muscle groups. We want to consider upper body strength, lower body strength, core strength, functional strength, and of course, bone strength. All of these contribute to proper alignment and use of the entire kinetic chain to support proper movement patterns. So some strength strategies for you to take away. Use your mobility strategies such as static and dynamic stretching to help warm up the muscles and joints for movement and to prevent injury. Always begin a new program with lighter loads. The last 3 repetitions of a set should be challenging. Increase the weight slowly to avoid overloading and potential injury. Take at least 60 seconds rest between each set of the strengthening exercises. Limit your strength training workout to no longer than 45 minutes. And remember that even 10 minutes can be beneficial. Take the time to cool down the muscles after stretching, and then rest at least 2 days between strength training workouts. And remember to breathe and hydrate. Cardiovascular fitness is another important part of that foundation. Your heart is like any other muscle and it needs to be worked out to stay strong. The heart is a muscle that is responsible for pumping that blood to the rest of your body, which we need for the muscles to function. Think of the heart as the body's engine that makes it keep running. Just like any other engine, there can be wear and tear. So aging can cause changes in your heart's function. So improving your endurance and stamina can help you complete your everyday tasks and exercises without being over fatigued. Improving this fundamental aspect also helps prevent heart disease. And as always, talk to your doctor or fitness professional to make sure you understand your own heart rate, your own resting heart rate, and the training zones that are safe for you. We can monitor our efforts in cardiovascular exercise by using a rating of perceived exertion scale as a guide in measuring your own workloads. When you are exercising, ask yourself, how hard am I really working? On a scale from 1 to 10, how would you rate the effort? With 0 being no effort at all, and then 10 being maximum effort. Also, it's important to recognize that intensity is different for everyone. Riding a bike at level 1 may be a maximal effort for one person, while others, it may just be a warm-up, and that's okay. This slide shows some strategies for cardiovascular fitness. It separates the recommendations into 3 categories. So if you're not doing any cardiovascular exercise at all and haven't exercised regularly in a long time, there's some pointers for you there. And then if you've currently exercised, but sporadically, then less than twice a week, we have some specific different recommendations there. And then of course, if you are exercising 3 times or more, then congratulate yourself on your healthy habit, keep it up. And we have some recommendations there as well. So there are several other factors that contribute to a solid platform of lifetime fitness, which represents the last fundamental area of the performance pyramid, as I pointed out before. This includes your body composition, nutrition, sleep, recovery, stress, and hydration. The human body is composed of lean body mass and fat tissue. The lean body mass is made up of your bone, your muscle, your blood, the bodily fluids, the organs, and your connective tissue. Adequate levels of bone, muscle, and fat are critical for overall health and function. And then fat, on the other hand, provides protection, insulation, and energy. Too much or too little fat can compromise overall health as well. Your genetic makeup will affect your body type and metabolism, but lifestyle choices have a powerful effect as well. An ideal body composition is the point at which you have the most energy and strength to perform at your best, prevents or helps manage high cholesterol, high blood pressure, diabetes, heart disease, and osteoporosis, and reduces orthopedic stress injuries. So we want to find that middle ground that highlights all of those important factors. So here's some simple body composition and lifestyle strategies. Sleep. Your body needs rest just as much as it needs movement. How we recover after our workouts or other activities can affect our performance on future workouts, or even just how we feel during the day. Your body needs about 6 to 8 hours of sleep every night for recovery, for optimum. High levels of stress can affect our daily lives in many ways and can affect our motivation or ability to complete workouts altogether. Finding ways to reduce those levels of stress, such as meditation or taking naps when needed, can help improve overall health and function of the body. Hydrate. Drink about half your weight in ounces to ensure proper function of the physiological systems. And then eat nutrient-dense foods, more fruits, veggies, whole grains, protein, and avoid that excess sodium and sugars. So now, by completing an assessment of the 5 fundamental physiological functions, your goals may look a little different. You may see that they've changed a little bit based on what you've learned from that assessment. So there may be all 5 new goals coming out of each section of the pyramid. So what does the research say about how much we should be exercising? This study by Blair, Lamont, and Nguyen is a comprehensive review of the evolution of physical activity and exercise recommendations. The authors discuss the reasons for the differences in the recommendations over the years and why things have been modified. Further, they summarize the recommendations to provide clarity on what people should be aiming for when prioritizing exercise goals. So check it out. There's a lot of helpful information there about certain methods and procedures that ultimately help shape our recommendation for exercise that we pass on to you. So the ACSM guidelines are based on the FIT principle, which represents your frequency. That's how often, your intensity, how hard, your time, how long, and your type, your modality of exercise. So for each of these categories, we include aerobic training, resistance training, and flexibility training. And these principles are easy to apply to your workout since intensity is based on that RPE scale. We can create your program based on your own levels of perceived exertion. We want to make sure that you're not overtrained. So save this slide and use it as a resource to say, okay, am I getting enough stretching? Am I getting enough aerobics? Am I getting enough resistance training? And just to highlight for the older population, these are the physical activity guidelines for Americans at health.gov. Basically, the important takeaway here is you should understand your own limitations and abilities and work within those conditions. For equipment recommendations, I included a laptop. Times have certainly changed. Many great virtual classes and guided workouts we can get in during the day when you normally wouldn't have the time. Some other recommendations are some resistance bands, a mat, dumbbells are used for upper body strengthening, but you can also use household items, detergent, water bottles, things that just create a little bit of a load. But frankly, we can make exercise work with no equipment at all. Body weight exercises can be done with nothing and are very functional. So now we can look back at our list of relatable barriers and know that we can turn those challenges into successes. So if you find that your barriers are listed on that left side of the screen, let's look over to the right side of the screen and see how we can change those barriers and change that challenge into a success. And just some final thoughts. Remember, there's always something you can do to keep moving. Even if you're experiencing pain or discomfort, the body will usually respond better to gentle movement rather than inactivity or sitting around. Daily exercise can help maintain and improve strong muscles and bones and can help keep the joints and tendons and ligaments flexible, allowing your body to move easier and avoid injury during everyday activities. Whether it's climbing the stairs or in your house or picking something up off the floor, carrying groceries home, or being able to tie your own shoes, everyday activities require the ability to maintain balance and position, and exercise can help with that. Even small amounts of exercise can make a difference no matter the age. Exercise is important more now than ever because we're living longer and we need to be comfortable when we're older. Exercise has been proven to help prevent falls by strengthening those muscles and support our bodies in movement. And be careful not to sit for too long periods of time, just to avoid that stress on the hips and low back. When you sit all day, you're not using your strong muscles of your lower body to help you hold you up. So then they can weaken and therefore not support you as much. Drink plenty of water. I can't say that enough. Follow a well-balanced diet of fruits, veggies, protein, and whole grains, and aim to get at least 7 to 8 hours of sleep every night to give your body time to rest and recover.
Great. Thank you so much, Kelyssa and Dr. Nguyen, for those seriously in-depth presentations. We now have some time for audience questions. I just want to address first that we will share this presentation. It's also being recorded in case there's any notes that you might have missed or want to reference back the slides. Someone asked if biking counts as weight-bearing exercise. Kelyssa, would you like to take that?
Yes. Was that biking?
Biking, yes. Cycling.
Biking, yeah. Not really, because you aren't actually taking the load of your body weight and loading up the joints with the body weight. But it's a good low impact exercise that can help get your heart rate up. It can help loosen up the joints, get that blood flow going, increase that just everything you need to move. And so the bike is good, but it's not quite full body weight bearing.
I agree with Kelyssa. I think if you think about the position that you're in, biking, you're sitting. So just thinking about that type of framework, it's a good low impact exercise. You get a good cardiovascular workout out of it, but it's not considered weight bearing.
Thank you both for clarifying. Dr. Nguyen, could you speak a little bit about exercising or moving with autoimmune conditions, as well as someone who is struggling or is experiencing sciatica?
The key with those two conditions is making sure that you're exercising safely and not triggering either the inflammation from the autoimmune condition or the nerve pain from the sciatic symptoms, which may be coming from your lower back. So I think the first step is to identify the triggers, which are individualized for you, for what might increase inflammation or might trigger the sciatica, and then modifying your exercise routine to minimize aggravating those symptoms. I think if you've ever worked with a physical therapist, I think if you don't feel comfortable exercising, then perhaps working with a healthcare professional might be a safer way to get started, and also seeing a physician to assess the cause of the sciatica if it's not been properly diagnosed, in which case we, as well as other healthcare professionals, can better provide guidance regarding what exercises are safe.
There was a question on series of exercises. Does it matter if I do a set of exercises, one after the other, or rest between each different exercise? So Kelyssa, maybe you could highlight the importance of rest or how someone should structure their exercise routine.
Yeah, I think it's important to just think about what the theme of your day is. If you're working on strength goals, then your strength goals need 60-second rest in between. So if you're working on, say, a bicep curl for your arms, you want to really focus on that exercise and just take your first set, take your full rest, and then complete the subsequent sets after that. If you're doing something for more of an endurance goal, meaning you're trying to just move and get your heart rate up a little bit, you can have a list of exercises. You can complete one set on the first one, then the next set on the next one, and then just like a series, and that's called a circuit. And then you can stop at the end and then repeat the whole circuit again. And that the goal of that is to kind of minimize the actual rest that you're taking between exercises. But say you started with a bicep curl, and then the next exercise is a leg lift, you're resting your upper body while you're working your lower body. So you're kind of going back and forth in between different goals. So you're still getting a rest that particular exercise, but you're keeping moving, which is going to target those endurance goals.
Great, thank you. Dr. Nguyen, I know you referenced osteoporosis in your presentation. Are there any exercises that you should not do with osteoporosis?
Yeah, so certain exercises that involve bending or flexing your spine are ideally to be avoided because those positions can increase stress along the bones of your spine and can potentially contribute to spinal injuries like vertebral fractures. So I think that's the main consideration.
Great, thank you for clarifying. I see some questions about finding a physical therapist, following up with HSS, and also about the recording. So I will provide all of that information in a follow-up email, as well as information about scheduling appointments with both Dr. Nguyen and Kelyssa in their respective areas. With that, I am sorry to announce that we are over time at this point, but I did want to, thank you both so much for these in-depth presentations. Dr. Nguyen, you really showed us why exercise is important, and the deep dive into the research behind movement and physical activity really helped to understand how it can actually impact our health and well-being. And Kelyssa, you showed us how to actually start and why, especially by addressing those barriers to exercise, how we really can start to incorporate this into our day to help improve our well-being and move better and feel better, which is what we love to do here at HSS.